everybody, it's Dr. Goldson again, here to bring you helpful tips about how you can get rid of some of the pain that you've been dealing with. You know, a lot of people have neck pain and low back pain that they've had for a very long time. You've thought about going to a chiropractor, you've thought about going to an acupuncturist, you've tried massage therapy probably, you've gone to your medical doctor, they prescribe pain meds to you, and you're just frustrated and fed up at this point. At this point you just want some relief. So what I want to go over today is spinal decompression and how that can help people who have neck pain, sciatica, low back pain. If you've ever heard of facet syndrome, these type of conditions where basically there's compression across your spine and your joints, and that you need actually to be elongated to take some of that pressure off. That's what we have here is our spinal decompression. This is a Chattanooga decompression table. The table itself, along with this headpiece, it works together. This headpiece is where the force is generated to actually stretch out your spine, your neck, or your low back. This particular machine can be adjusted up to 500 pounds of pull. Not that we actually ever go that high. Typically, if we're doing someone's neck, the maximum we're going to go is about 35 pounds. If we're doing someone's low back, it's really going to depend on the weight. Someone 250 pounds, we're really going to do about 125 pounds of pull. And if somebody's 100 pounds, maybe 50 pounds of pull is probably going to be enough. And so how the spinal decompression works is when you have a condition that's a disc bulge or a disc herniation, the disc has become flat. And so when that disc has become flat, it's under a lot more stress. And with that stress, it can push the disc out on nerves and cause even more pain. So it would make sense, in essence, if we could basically almost treat our spine like an accordion and just pull it up, we can take stress off the disc. As soon as we stand up, gravity is pulling us down. So that's our disc. Our job of our disc is to provide cushion between the spine. So as soon as we stand up, gravity's pulling us down. But if we could train the disc or maneuver the disc to elongate, then we have some chance for relief. And that's why we have spinal decompression. This tool is our harness tool. You'll see how we use our spinal decompression for our lumbar conditions with one of our previous patients. But for our cervical patients, our neck patients, this is our harness tool that we use. Basically, we strap it in. We release the rope. This, again, inside this machine is the motor that's going to pull this up, and we can set it in a level of sequence. We just don't want the spinal decompression, and I don't care if you're going to try it here or you're going to try it someplace across the country where they have decompression. I want you to understand how it works. So when you go into the office and they're prescribing spinal decompression to you, in essence what they're doing is this. We're saying you have some type of disc or joint damage, and if we take pressure off of it and elongate it, it'll help to fix it. If it's the neck, this harness gets locked in. You take slack off the rope. Again, the person is going to lie on their back and their head's going to fit into this harness. They're going to basically adjust the neck piece so that it squeezes the base of your skull, which is called your occiput. The pressure is going to be right here, and you're going to be pulled in the direction of the machine. What you should expect from that spinal decompression, the first time around is usually adjustment period. You're usually just getting used to it. And actually at first you don't want to do too much because you can cause yourself a little bit more discomfort. And how can you cause yourself discomfort? Because your muscles can be spastic and can be inflamed, and can be sore themselves. So as this machine is starting to pull your head this way, the muscles can start to fight that pull. While the goal of this treatment is to attack the disc and take pressure off the disc, your body is more than just one thing. So if you have a lot of inflammation, a lot of muscle tension, you might find a little bit increased soreness in those areas while trying decompression. That's why you start off really slow and really moderate. But over time, what you should expect is if you have ridiculous symptoms, or if you have pain or pinched nerves that's causing pain radiating down your arms, or you have facet syndrome, what you should notice is a decrease in that symptom, where we call it centralizing. If you have pressure on a nerve, it can peripheralize down your arm. That's peripheralization. But if once you take pressure off the nerve, the symptoms with nerve pain don't get better just like that. It takes a little time. But what you'll notice is the symptoms will go less down to the fingers and more of the arm, which we call centralizing. So you should expect some relief immediately. You should expect over time some centralization. This is not a therapy that you can use just one time. We're training the disc to basically go back inside the herniated piece of the disc, to go back inside the whole entire disc. So over time, you should expect, with multiple 6 to 12 treatments, you should expect some relief as far as reduced radiating pain, reduced neck pain, reduced low back pain. And again, it's for people who have herniated disc, bulging disc, or bulges. Again, I'm Dr. Goldson. I just want to give you information that can help you. So even if you live nearby, you can come see us at Goldson Spine, one of our 4 locations. We'd love to see you. But if you live far and wide, I want you to have information so that when you walk into the doctor's office, you can know what to ask for and you can know what to expect. If you like the video, please hit like. If you have comments, if you didn't like it, leave that information too. If you have questions, leave that. We'll always give you some feedback. Have a great day. God bless you. Peace.